What is neonatal sepsis? Neonatal sepsis is a serious medical condition where a newborn's body responds to infection in a way that can affect multiple organs. Early onset sepsis occurs within first 72 hours of baby's life. Etiology primarily results from vertical transmission of pathogens from the mother during labor and delivery. To confirm sepsis, either early or late onset sepsis, we perform several tests. Number one, blood cultures. This is the gold standard for diagnosing sepsis, involving the collection of blood samples to identify causative organisms, bacteria. And then treatment. Prompt treatment is crucial. And why is it crucial? Sepsis is particularly dangerous for neonates due to several factors. Number one, very important, immature immune system. Welcome. Neonatal sepsis. Rule out neonatal sepsis. It's a very common admission to neonatal ICU. And as a neonatologist, dear parents, I recognize that hearing your newborn may have sepsis is deeply concerning. My goal today is to provide you with a thorough understanding of neonatal sepsis, covering its causes, symptoms, diagnosis, treatment, prognosis, and some preventing measures. What is neonatal sepsis? Neonatal sepsis is a serious medical condition where a newborn's body responds to infection in a way that can affect multiple organs. It's more common in premature infants due to their underdeveloped immune system. Neonatal sepsis is classified into two categories based on the timing of onset, so early onset sepsis and late onset sepsis. And first, let's talk about early onset sepsis. Early onset sepsis occurs within first 72 hours of baby's life. Etiology primarily results from vertical transmission of pathogens from the mother during labor and delivery. Common causative organisms, bacteria, include group B Streptococcus, GBS, and Escherichia coli, E. coli. What are the risk factors for early neonatal sepsis? First, maternal colonization with group B Streptococcus, then prolonged rupture of membranes for more than 18 hours, maternal chorioamnionitis, infection of membranes, premature birth, and invasive procedures, some medical interventions like the use of catheters that can introduce pathogens to the newborn. Symptoms often manifest within, as mentioned, first day to 3 days of life and may include respiratory distress, which is a rapid breathing sound that baby is making when baby is breathing, that is called grunting, flaring nostrils or chest retractions. Then temperature instability, either fever or rather hypothermia in babies, lethargy, so decreased activity or responsiveness, poor feeding, difficulty in feeding or even a refusal to eat, hypotension, which is low blood pressure, and in severe cases, seizures. It's important to note that these symptoms can resemble other conditions, making sepsis challenging to diagnose based on clinical presentation alone. And then late onset sepsis occurs after 72 hours of life, extending up to 28 days of baby's life. Etiology is often associated with some nosocomial infections acquired postnatally. Common pathogens here include coagulase-negative Staphylococcus, Staphylococcus aureus, or gram-negative bacteria. Risk factors of late neonatal sepsis: prematurity and low birth weight, prolonged hospitalization, use of invasive devices like central venous catheters, PICC line, and exposure those babies to broad spectrum antibiotics during the hospitalization stay. Symptoms of late neonatal sepsis may include apnea, which is pauses in breathing, bradycardia, slow heart rate, temperature, instability, again fever or rather hypothermia in babies, lethargy, decreased activity responsiveness, feeding intolerance, vomiting, abdominal distension, jaundice, which is yellowing of the skin or eyes, and again severe cases, seizures. To confirm sepsis, either early or late onset sepsis, we perform several tests. Number one, blood cultures. This is the gold standard for diagnosing sepsis, involving the collection of blood samples to identify causative organisms, bacteria. However, it's important to mention that blood culture results can take 24 to 48 hours for results to come back. Then CBC, complete blood count, not very specific and sensitive test, but a test that assesses number of white blood cells, also platelet count, and helps us, this test helps us to differentiate and detect abnormalities that could be indicative of bacterial infection. Two tests, other blood work tests, seroactive protein and procalcitonin levels. These inflammatory markers that we obtain from the blood test again can support the diagnosis, but their sensitivity and specificity vary, and they are not definitive on their own. Another test, urine analysis, in which we detect an urinary tract infection, lumbar puncture to examine cerebrospinal fluid for signs of meningitis, especially if neurological symptoms like seizures are present, or irritability or lethargy. And then imaging studies, chest X-ray or ultrasounds to identify any potential sources of infection. So these tests help us to identify the specific organism causing the infection and determine the appropriate treatment. And then treatment, prompt treatment is crucial. And why is it crucial? Sepsis is particularly dangerous for neonates due to several factors. Number one, very important, immature immune system. Newborns, especially premature infants, have underdeveloped immune defenses, making them more susceptible to infection and less capable of combating pathogens, bacteria effectively. Then rapid progression in neonates, also due to immature immune system, then rapid progression. In neonates, also due to immature immune system, sepsis can escalate swiftly, leading to systemic inflammation and multi-organ dysfunction within hours. This rapid progression increases the risk of severe complications and mortality in babies. Then subtle symptoms. Early signs of sepsis in newborns are often very non-specific. It may be just poor feeding or lethargy or temperature instability. These subtle indications can delay diagnosis and unfortunately treatment, allowing the infection to advance unchecked. High mortality rate. Neonatal sepsis remains a leading cause of infants' death worldwide. The combination of immature immune system and the rapid onset of severe symptoms contributes to a high mortality rate if not promptly treated. If neonatal sepsis is not recognized and treated promptly, it can lead to serious complications like meningitis. Infection can spread to central nervous system, leading to inflammation of the brain and spinal cord membranes. This condition can result in long-term neurological deficits or developmental delays. Then respiratory failure. Sepsis may cause acute respiratory distress syndrome necessitating mechanical ventilation, oxygen support, and intensive respiratory support. Cardiovascular instability, something that is called septic shock, can lead to hypotension, poor perfusion, increasing the risk of organ failure. And finally, DIC, disseminated intravascular coagulation. Sepsis can disrupt the body's clotting mechanism, leading to widespread clot formation and bleeding. Metabolic imbalances, conditions such as hypoglycemia, so low blood sugar, electrolyte disturbances, are common in septic neonates. Renal failure, reduced blood flow and oxygenation can impair also kidney function, leading to acute kidney injury. Long-term neurodevelopmental impairments, survivors of neonatal sepsis are at increased risk for cognitive, motor, and behavioral challenges later in life. So that's why it's crucial to recognize and treat possible sepsis in neonates. How do we treat neonatal sepsis? Obviously with antibiotics. In early onset sepsis, empirical antibiotic therapy is initiated promptly, typically with 2 antibiotics, ampicillin and then aminoglycoside, which is gentamicin, pending culture results. Once culture results are available, antibiotics may be adjusted accordingly. Duration of therapy, for culture confirmed infection, antibiotics are continued for about 10 to 14 days. If cultures are negative, infant doesn't have any symptoms, the team usually discontinue antibiotics after 36 to 48 hours. Late onset sepsis, we typically start with broad spectrum antibiotics to combat the infection. Once we identify the specific bacteria pathogen, we may adjust medication antibiotics accordingly again. The duration therapy, it's about the same 10 to 14 days. The exact duration may vary depending on the pathogen and then clinical response of the baby to the treatment. Supportive care, including intravenous fluids, respiratory support, may also be necessary. What are the prevention strategies for neonatal sepsis? For early onset sepsis, screening and intrapartum antibiotic prophylaxis for GBS in pregnant women, then adherence to aseptic techniques during labor and delivery. For late onset sepsis, strict hygiene is very important. Infection control practices in neonatal ICUs, then cautious use of invasive devices like PICC lines, and prompt removal when they are not longer necessary, and antibiotic stewardship to prevent the emergence of resistant organisms. Prognosis. With early detection and appropriate treatment, many infants fully recover from neonatal sepsis. However, the condition can be life-threatening, especially in very premature or low birth weight infants. In conclusion, early recognition and timely initiation of appropriate therapy are vital in managing neonatal sepsis effectively. Tailoring treatment based on the culture results and clinical response, along with diligent supportive care, enhances the likelihood of favorable outcomes. If you need any further information, if you have any questions, please contact me at neonatologyforparents.com.